thing that really concerned me and is that he started just doing this, and I think you notice he just kinda starts laughing,
Mhm.
and not for any reason, you know, he just I mean, he's not a joke or a TV show that's funny, he'll just start laughing.
So I did notice that, Zach, you've laughed a couple times. Is there something going on?
No, they just said a funny joke.
Somebody said a funny
Yeah,
joke?
yes.
Who was that?
My friends inside.
Your friend
Inside?
inside.
Yes.
Okay. What was the joke?
They don't want me to tell you. You won't understand.
Okay. So are these friends, are they do they have names? Do they have
Yes, they have names.
yes, they have names.
Yes.
And are they how do you hear them? Do you hear them like you hear my voice right now?
Just like your voice. But you
Mhm.
guys you guys can't hear him. You won't understand.
Okay. How long has that been going on, Zach? How long have you known these folks?
2 weeks.
2
2 weeks.
weeks?
2 weeks.
Okay.
2 weeks and 2 days.
2 weeks and 2 days.
Yes.
Okay. And Judy, you mentioned that that seemed to have been happening over the last how long?
The laughing,
Yeah.
um, that's been, I would say, within the last couple of months when he stopped going to school and he stopped going to work, and then he had an incident at the on the campus where he was going to school. Security had to, um, go and pick him up because well, he was walking around the campus in a white robe.
Along with possible hallucinations and vague delusional thoughts, Zach presents with a concerning episode at his school campus. This may be indicative of disorganized or odd behavior that can be a part of an acute phase of a schizophrenic episode.
So walking around campus in a
And then
white
he was
robe and
disrupting classes,
okay.
especially I think they said it was a religious class that he was going in, and I don't know what he said,
Okay.
but, security was called in.
Zach, do you wanna talk about that a little bit?
What?
So your mom's talking about a time when you were at school, and it sounds like, there was some involvement with security.
I
Uh,
I went to school.
you went to
Yes.
school, and then maybe there was a time when you were wearing a white robe of some sort, is that accurate?
Scientists wear white robes to do science
Okay,
and chemicals, and when they're mixing chemicals, they wear white robes.
okay.
NASA too. NASA.
So
NASA wears.
NASA and scientists, what were you wearing the white robe for?
They told me to.
This last statement by Zach is alarming. While many people may report hearing voices, these can often be heard as murmuring, whispering, or general commentary. But when a person reports command hallucinations that they follow, this puts them in a higher risk category and should be reported to their psychiatrist as soon as possible. Or, if they don't have a current psychiatrist, a referral should be made immediately. In a more thorough assessment session, I would have gone down this path further and explored if the voices ever instruct Zach to act in dangerous or violent ways.